October, National Pregnancy and Infant Loss Awareness Month. The story of Sarah Kay. The month of October is National Pregnancy and Infant Loss Awareness Month. During the entire month, we take time to honor and remember those who have lost a child during pregnancy or lost a child in infancy. In this month, we remember the babies born sleeping, those we carried but never held, those we held but could not take home, and those who come home but could not stay. Dealing with death in the family is never easy. Miscarriages, stillbirths, and infertility are examples of losses that often are not mourned publicly. Even close friends and family may not understand the impact of the loss unless it's explained to them. I choose to share my story, she says. I hope it brings you light, encouragement, and the understanding that you are not alone if you've lost a pregnancy. And may this also be an eye-opener to counselors, therapists, and pastors, knowing what to say, what not to say, and what to do without hurting the feelings or stepping on the toes of those who have had miscarriages. 1 in 4 women will lose a baby during pregnancy, delivery, or infancy. A majority will suffer alone. Christians should never have to face trials on their own. Those around them should rise up and support them. Carry each other's burdens, and in this way, you will fulfill the law of Christ. The Bible states in Galatians 6:2. The story of Sarah Kay. I lost 2 pregnancies through miscarriages when I was young in marriage. The day I found out I was pregnant, I was excited. I memorized my due date and began counting the days until our child would arrive. A few weeks into the pregnancy, I started spotting and felt feverish. I needed to see a doctor, and being new to the city, my husband suggested we visit a clinic nearby the university where he was a student. Without any lab work done and no question as to whether I was pregnant, I was prescribed antibiotics and malaria medicines, which I took without a question because the doctor prescribed. There was a lack of proper diagnosis, and there I was doing more harm than good to myself. I took the meds for 3 days, after which I started bleeding more, and my husband rushed me to the hospital. By the time we made it to the hospital and saw the gynecologist, I had lost so much blood and knew there was no hope of saving my baby. The gynecologist checked me, and from her words, I knew my pregnancy was beyond protection. There was no stopping my tears from pouring out. All the hopes and dreams we had for our child and our future came crashing down. The doctor carried out the normal procedures, and I was sent home. I cried and moaned, catching only glimpses of rest. In the darkness and grief of that night, we finally had to come to terms with the fact that we had lost our baby. My husband is taking his master's classes, and having lost a whole day of school, he woke up early in the morning and left her classes. In the days ahead, I experienced a horrible sense of loss and unfairness. I asked why other women could have children with no complications, but not I, even when we were both serving God and I had kept myself pure before marriage. I went ahead with my daily chores, cleaning the house, washing clothes, planning, and making meals, and I was exhausted physically and emotionally. With time, I became so easily overwhelmed with my responsibilities, and I desperately needed rest and peace. Yet in the first week of sorrow, I had little of either. Since my husband continued with school, it was hard for me to tell if he was grieving his loss too. However, later I learned that men and women often have very different ways of dealing with painful emotions. Upon returning to the hospital for follow-up, after the miscarriage, the gynecologist did confirm the wrong and unnecessary prescribed meds I took caused the miscarriage. 2, she undertook an oral examination and an ultrasound to find out why I was spotting, what could have caused the miscarriage, and found out I have a short cervix, and all I needed then was a full bed rest and other procedures to save my baby. Thank God for Dr. Lecca. All I needed was to be made aware of my pregnancy risk factors and what to do to prevent future miscarriages. And this is one reason why we should break the silence on pregnancy loss and educate young mothers on the need to seek professional help during pregnancy. Though my husband and I attended a Christian university that was training pastors and pastors' wives, the women I went to class with never paid me a visit. Only the wife to the vice chancellor visited me and to find out why I had missed classes for 2 weeks. With no word to say, she said a prayer for me, and off she drove with the demand to see me in class the following week. Growing up, I knew there was a taboo and stigma around pregnancy and infant loss, and I assumed that is why school was more important for her to discuss than my loss. Upon returning to school on the 3rd week, the women in class had already learned about my miscarriage. Before the beginning of class, a moment was set aside for a few women to say a few words of encouragement. I was showered with words such as, "Sarah, you are very young. You can always have another pregnancy. Next time, things will be better. It's all for the best, because God has a better plan for you. Please don't worry a lot. God will give you another baby. Thank God you had not seen the baby. You are lucky you had not stayed for long with the baby. It's for the best. The baby was probably deformed. It's better it happened so early. I know how you feel. Move on. It has been 3 weeks." And the lights. Though my fellow classmates tried to help, it made my state worse. I thought like they belittled my grief. They never understood what I was going through. For a moment, I questioned my feelings and wished no one should have told them what I was going through. Later in life, I understood they really wanted to help, but did not know how. Although it is not easy going through trials, it is also tough being on the outside trying to help those who are suffering. On the 4th week, my mother, sister, and my auntie paid us a visit. They offered comfort and prayed with me. That was the beginning of healing from the loss of my baby, after which I turned to God through prayer and reading the Bible. I received the encouragement that I needed to make it through the storm of grief and found a peaceful place in my broken and devastated heart. In the days ahead, I still had moments of relapse, experienced a horrible sense of loss and unfairness. My body would respond with a wall of brokenness. I would experience a myriad of emotions. I would be numb, sad, hurt, and most of all, lonely. I genuinely felt no one could understand my pain in that moment, even my husband. I asked why other women could have children with no complications, but not I, even when we were both serving God and I'd kept myself pure before marriage. I literally questioned God's fairness. However, later in life, I read the words of Jocelyn Hutto in the book Trusting the Lord of Life When Death Visits the Womb, which did resonate with my thinking then. It reads, "For many of us, the effects of sin in the fallen world seem like distant theological concepts that carry little weight in everyday life. As a result, we live with expectations befitting pre-fall Eden rather than sinful, broken earth. We expect to live healthy, fulfilled lives. We expect to become pregnant easily, carry my baby to full term, and deliver them in perfect health. Our hearts yearn for the creation to function as God intended it to, and this we don't naturally expect pain, discord, or death. Yet this is exactly the inescapable inheritance we've received from our first parents. I had to make peace with the scriptures, which teaches that the righteous suffer in order that they might glorify God in their lives, and for God to teach them lessons in prayer. I had to allow God to comfort me just as he has promised." 2 Corinthians 1:7. During my trying moments, I needed to hear from pastors and pastors' wives, and did not get that. I needed to hear from other women who had weathered a similar situation. I felt abandoned and alone in my sorrow. I needed books to read about others' experiences, but found none in the university library. Such would have helped me feel less alone. There are things that I wished for during that moment. Women to share in my sorrow, another woman's shoulder to cry on, to hear from other women who had gone through the same type of loss. It's not easy going through a miscarriage alone. I needed a support group to provide support after the miscarriage. Women need solace, strength, and integrity as they grieve and journey to recovery after losing their babies. Counselors, therapists, and pastors initiate such if there are none existent in your line of work. I healed from my loss. I have worked with different women in the course of my ministry to manage the unfamiliar emotions that surround loss of a pregnancy. Last but not least, I would like to say it is important to know how to care for women who lose their babies, whether through miscarriage, stillborn, sudden infant death, a few minutes after or days of birth. I thank God because He created resilient beings. Life does go on after loss, though in a different way than before. It's comforting to know there is help available on this journey. Those who have walked the same path, as well as counselors who have helped guide people in times of loss, can be a source of consolation and healing. Don't suffer alone, or don't ignore those who are suffering. The following are what you can do to care for women experiencing this. First, treat the miscarriage as death. The growth of another life within one's body is an amazing miracle, and the loss of this life can be heart-wrenching. For the mother-to-be, life began at conception, and she may have quickly made room for this life within her heart and her family. The resulting void may be as tangible as the death of an existing family member, and this should not be minimized. Secondly, approach the mother in a warm, understanding manner. Let your verbal and nonverbal communication demonstrate that you take her loss seriously. Indicate her feelings are reasonable and valid. Thirdly, offer your support. Every woman will have their own miscarriage experience or emotional and physical outcomes. Depending on the specifics of the miscarriage, women may have different needs. Some may need time and words of comfort and encouragement. Some may need support in daily activities due to physical complications. And other mothers may need to hear other stories of miscarriage to normalize their own experience. Listen. Give the mother the chance to talk about her experience, her feelings, and her fears. Call the mother, ask her if she would like to talk, and then make a date to do so. Upon visit, allow the mother to review this experience and express her feelings and memories. This will facilitate the grieving process. Fourth, we offer counseling tips. Encourage mature coping mechanisms and help through the grieving process. You can encourage the woman to express her feelings by giving her permission to grieve. Encourage the mother to acknowledge and work through her pain rather than avoiding it or suppressing it. Encourage healthy ways of expressing the pain, including journaling, praying, talking with close friends, or counseling. Encourage feelings of normalcy. Ask about a quilt. Encourage acceptance. Encourage the involvement of family members. Lift the woman in prayers. Make phone calls and send notes of concern. Ask about the rest of her family. Be ready to listen. Help the woman decide if and how she wants to remember her lost baby. Ask them to establish a simple daily schedule. Encourage the need to maintain a regular sleep schedule. You can encourage them to keep up with their exercise, advise them on eating well, caution on risky behavior, or encourage them to delay a big decision. Encourage doing something for herself every day and remind them to take, if necessary, any medication they've been prescribed. Inspire her to reach out to a religious community, and you can motivate her to join a grief support group. You might be asking yourself, what can I say during this time? The following are such. I am sorry for your loss. It's okay to cry. Your baby is worth crying about. Please know I am here to listen to you for as long as you need. God cares for you. He understands your pain, your confusion, your anger, and can handle them all. And I'm here for you. Can I pray for you? In all of this, it is important to understand the grieving process. If you had a pregnancy loss, you may be having intense and sometimes confusing feelings. This reaction may occur no matter how early the pregnancy ended, even if it was only a few weeks along. Grief is a natural and normal response to an important loss. It is normal. It is a normal way of learning to accept the loss, to heal from it, and to always remember. You're not abnormal or insensitive, however, if you do not feel sorrow or grief after a pregnancy loss. You may feel only disappointment. You may even feel relieved that such a difficult period of anxiety and uncertainty is now over, or you may be overwhelmingly sad or confused. When you were pregnant, you may have spent hours daydreaming about what your baby would look like and what kind of person she or he would turn out to be. This is a normal process of bonding. Grieving is the process of letting go of your emotional attachment to your baby. You are grieving that the bond that you felt with your baby now has been broken. Thus, when it comes to grief, it doesn't matter how early in pregnancy you were struck by loss. Your feelings are real and they ought not be denied. It may be of some comfort to know that there is help available on this journey. Those who have walked the same path, as well as counselors who have helped guide people in times of loss, can be a source of consolation and healing. The stages of grief. There is a process of emotional healing common to many people who have had suffered from any important loss. They're not always linear and expressing themselves in different forms. It usually consists of the following: shock and denial, guilt and anger, depression and despair, and lastly, acceptance. Knowing when you might need professional help. Don't be afraid to talk about your feelings with someone. Acknowledging your feelings and hearing yourself describe them out loud are very helpful. A common myth is that the way to heal is to forget, but in reality, it is remembering that allows us to grieve and to heal. You need to seek professional help for depression and complicated grief. It is especially important to see a doctor to get professional if you fall under any of the following categories. You feel stuck emotionally and can't seem to move on. Numbness or denial, though a normal part of the grieving process, is if not followed by realistic acceptance of the loss or appropriate emotional expression, then one can seek a professional support. 2, you're so overwhelmed that you cannot function adequately or function at work or home. 3, your feelings interfere with your relationship with those close to you. 4, your feelings cause you to become violent or hostile to others. 5, your feelings are keeping you from getting up in the morning or taking care of yourself. Your personal hygiene suffers. For instance, you can't eat or sleep. 6, you have suicidal thoughts. Or 7, months or years go by with no improvement. However slow or painful, you may be suffering from complicated grief or prolonged grief. Even if your feelings are not this overwhelming, it can be extremely helpful to talk to a counselor or therapist, especially if you are worried in any way about whether your feelings are normal. If you feel stuck emotionally and can't seem to move on, consider looking for outside help. There are many counselors, therapists, support groups, and self-help organizations that understand how to help you get through your grieving. Understanding your partner's grief. Your partner is probably grieving his loss too, but it may be hard for you to recognize this. Men and women often have very different ways of dealing with painful emotions. Your partner may, 1, tend to keep his feelings to himself because of fears of increasing your burden. 2, have difficulty listening to your concerns as an attempt to resolve your grief by talking. 3, think he has to be strong for both of you to keep things running smoothly in your relationship and around the house. 4, seem distant from you at times when you need him the most, and may, in fact, try to run away from his grief by spending more time at work. None of these reactions mean that your partner doesn't care about you or about the loss of the pregnancy. Talk to each other. Try to listen and respond to his feelings, to accept them for what they are. Consider seeing a couples therapist or counselor to provide a neutral place where you can both be heard and can more easily listen to each other. Letting the process take place. Grieving is ongoing, unpredictable, and painful. It may last a few weeks or as long as a few years. The loss will always be there, but eventually you will think of it without tears or overwhelming sadness. I'm strongly calling upon members of the society to stand with mothers and fathers who have gone through what I have gone through. I believe churches should provide resources that support women who have had miscarriages or stillbirths. Normalize visitations when appropriate, so that you might be able to interact with those who truly understand what you are going through. To those who've had to say goodbye too early, I am here to tell you that you are not alone. Thank you for your time, and as always, be kind to others. You never know what they're going through. You might be asking yourself what you could do in this month of October and beyond in relation to babies who died through stillbirth, miscarriages, or died after birth. The following are just a couple of ways that you can help. 1, raise awareness. Break the silence for pregnancy and infant loss. Let people recognize the unique grief of bereaved parents in an effort to demonstrate support to the many families who have suffered such a tragic loss. Thus, families receive understanding and support. 2, educate the public about ways to support bereaved families. 3, if you've had experienced the death of a baby through miscarriage or infancy, tell your story. Don't be afraid to tell others what that means to you. 4, advocate for women to go that extra step toward their health and pregnancy health. 5, empower women to educate themselves on the risk factors and what can be done to reduce those risk factors during pregnancy. 6, if you are a health professional, don't be afraid to tell expectant mothers about the risk factors and what they can do to reduce them. 7, empower pregnant women to have a healthy pregnancy. 8, observing rituals or paying tribute by planting a tree or holding an annual service, which can help mark and acknowledge the loss of a loved one. 9, advocate for people to acknowledge their feelings and share with others. This might help validate their feelings, provide them with emotional support, and alert others to the reality of loss. 10, encourage families to strengthen and broaden their social network. 11, encourage parents to address depression and any suicidal thoughts. And 12, Begin support groups. Millions of mothers and fathers don't know where to turn for grieving support after losing a pregnancy, or having a stillbirth, or losing a child after birth. They long for ways to honor their deceased babies. They face the devastating moments alone, desperate for support during or after the loss of a baby. Step in to help. Step in and offer the support that they need. Thank you.